In collaboration with BrainMind, welcome to the future of Alzheimer's disease. The future of brain health and Alzheimer's disease is an exciting one, and the future is now. We can implement a variety of techniques to understand what paths a person may be on towards Alzheimer's so that we can intervene early before symptoms begin. But truly, the future of Alzheimer's disease over the next decade is an extremely exciting one. We'll potentially be able to do a single blood test to understand a person's risk, and that one single blood test will actually print out an individualized plan for that person. Well, we can do that now. We can do that now in a very time-intensive and complicated way. In the future, we hope that a simple blood test will be able to give the instruction manual in an automated fashion. When it comes to Alzheimer's disease, there are currently specific biomarker tests that we can use. For example, a PET scan of the brain to see if there's amyloid in the brain. We can do a spinal tap or a lumbar puncture where we sample the fluid surrounding the brain. In the future, again, a simple blood test may be all that we need. Instead of looking at the brain in terms of a MRI scan or a CAT scan or a PET scan, which includes sometimes radiation. It includes traveling to a hospital or clinic and sitting in a machine for hours sometimes on end. In the future, maybe we won't need that at all. Maybe we can just look into a person's eye and understand their risk. There are now studies that have shown that different amyloid levels in the back of the eye may predict whether or not a person will develop Alzheimer's disease or may have it already. Looking at the blood vessels across the retina as another example is an exciting way. So within the next 10 years, all of these ways to potentially diagnose Alzheimer's may actually become a reality in terms of direct clinical practice. The other future of Alzheimer's disease is in an area called metabolomics. Metabolomics is not a blood test, for example, but it's looking at other fluids to understand the metabolism that's going on in the body as we speak. Using a better understanding of a person's metabolism is a way to better fine-tune an intervention to reduce that person's risk of Alzheimer's disease. Another really important aspect of the future of Alzheimer's disease is understanding a person's microbiome. People are made up of millions, actually billions, actually trillions of bacteria, all throughout our GI system. Throughout our gastrointestinal system, the microbiome, in some ways, makes us who we are. It doesn't just affect our stomach, it affects our brain. And if we can understand the signature, the different types of microbiomial contributions, if we can understand which bacteria are preferential for optimal brain health, we can hopefully understand how to reduce risk in a more targeted way. In the future, aside from getting brain scans, and aside from doing blood tests, we'll likely be taking microbiome samples to better personalize or fine-tune an Alzheimer's prevention and treatment plan. The future of Alzheimer's disease will also differ based on a person's biological sex. Men and women can take different roads to Alzheimer's disease. The perimenopause transition, specifically in women, can absolutely increase a person's risk in a way that's different when compared to a man. Women make up 2 out of every 3 brains affected by Alzheimer's disease. Why? Well, we don't know for sure, but the perimenopause transition may be one of these key features. And I believe that at some point soon, we'll be able to do brain scans on women, understand their metabolism and their brain bioenergetic changes at the very beginning of perimenopause. And if we can understand that there's a problem, we can intervene through a very specific drug or hormone replacement therapy, dietary change or otherwise, to push that woman off the road to Alzheimer's, or at a minimum, delay cognitive decline. The future of Alzheimer's disease also includes digital therapeutics. What if we could use our smartphone, or maybe even a biosensor device on the wrist, to detect that a person has the earliest phases of Alzheimer's disease? Well, research is going on now exciting research, including ways to digitally assess in both active and passive ways whether or not a person can be on the road to Alzheimer's disease. Research in our group has actually looked at some of these data, and these early data suggest that it's a feasible way of detecting the different elements of cognition just by using a biosensor device. We've also been working on digital therapeutics, where a piece of software can use elements of artificial intelligence to intake data and respond to give a person a targeted plan. Further, we can use digital assessments on that mobile device to understand a person's strengths and weaknesses in terms of cognitive function. We can assess just in time, every day, or every week, or every month from home, a person's cognitive function by just using data captured from smartphones that are used in everyday life. Further, the future of Alzheimer's disease includes more personalization of drug therapies. While mostly in the past we've used single drugs across all patients with Alzheimer's, in the future, different phenotypes, meaning different physical or real-life presentations of the disease, will require different therapeutics. As we know, blood pressure can be controlled by a variety of agents, from beta blockers to ACE inhibitors to calcium channel blockers, among many others. In Alzheimer's disease, it'll be the same way. Mrs. Smith, she'll need these two drugs based on her genetic makeup and based on precision medicine and based on her microbiome and based on her individual phenotype. But Mr. Jones, different biological sex, different risk factors, different genetics. He may need 3 different drugs, as well as 2 supplements, as well as a microbiome plan, as well as an exercise regimen. And these are all elements of the future of Alzheimer's disease that will be clarified in years to come. So the future of Alzheimer's disease is very exciting. The future of Alzheimer's disease lies in both genetic advances as well as advances in our understanding of lifestyle and environmental risk. Precision nutrition is an area that we are exploring every single day. And one day I hope that we'll be able to get either a blood test or a microbiome sample and analyze it, put it into a computer, and right then and there we can have a printout or an automated email to that person to tell them what foods and what nutrients that person may need versus may need to avoid in order to reduce their Alzheimer's risk. Across the spheres of Alzheimer's disease, from diagnosis to risk assessment and early intervention, we are going to be more precise in our understanding, more innovative in our approaches, and more effective in our ability to prevent and hopefully one day cure Alzheimer's disease.